The healthcare provider, if they're not aware of the disease, the first thing they see is, oh, it's a Black person, and oh, they just want drugs. That's the main thing that's been going on for decades.
Stories about Ontario's healthcare system, like Serena Thompson's, have been heard before. A provincial report has documented the racialized experiences of sickle cell patients, a genetic condition that occurs in people of African, Arabic, and Indian racial backgrounds. One of these stories reads in part, "My brother was 33 years old when he went to the ED with a crisis. They saw a Black male and told him he was looking for drugs, not having a crisis." That author continues to say the man was eventually sent home and was found dead the next day. Universal health care is something that is oftentimes celebrated around the world, but is this a system that treats everyone equally? Some Canadians are finding out that the quality of care can sometimes depend on the color of their skin.
Racism is systemic, and to believe that the healthcare system isn't like every other major mainstream system that is dealing with systemic racism is very naive.
Like Thompson and the patient in that report, members of Ontario's racialized communities sometimes face conscious or unconscious biases when accessing health care. In studies and surveys, young women of color, particularly Black women, say they've experienced racism when receiving care.
And almost 85% of them reported things like being called racist names by healthcare providers, racial slurs, unwanted sexual conduct, even things like being charged more for services, and when they checked with their white friends, they had a different experience.
American studies have long highlighted the disparity in care between whites and minorities in their healthcare system. But down south, they've been identifying barriers to good care by collecting patient data. Experts here north of the border say Canada doesn't do the same, and that's a problem in itself.
That is a racial bias. You're not concerned about the health care of every individual. You just want to make general statements. But what points to the fact that there is racial bias are the poor health outcomes that we can see for particular groups of people.
Toronto is, however, leading the way in what is described to be a groundbreaking first in Canada with a project that measures patient equality. In 2012, a group of 32 Toronto hospitals and clinics banded together to begin collecting patient demographic data to start tackling health equity across the system.
3 reasons why data collection is important: to find out what the problem is, to look at trends of how things are going, to be able to advocate for more resources.
Since 2013, the group has been asking clients to fill out this questionnaire about race, ethnicity, and sexual orientation. It's a project led by Mount Sinai Hospital and supported by healthcare providers throughout the city.
We felt that there was a real gap in data that speaks to measuring and or monitoring disparity in access, quality of care, health outcomes for racialized folks, low-income folks in the city.
Robertson says this data has already been proven useful to hospitals and clinics throughout the city. Ahead, I'll tell you how it's being used. I'll also tell you what the data says about the medical needs of particular minority groups here in the city.